Hello, and welcome to Nosotros, the podcast about San Antonio history, politics, cultura, y más. I'm Elaine Ayala, your host and a Metro columnist for the Express News. My guest today is George Hernandez, President and CEO of University Health, the sprawling $3.1 billion healthcare system that operates 2 public hospitals and will soon operate 2 more. Welcome.
Thank you, Elaine.
It's so nice to have you here.
It's good to be here.
In our little studio. We enjoy it so much. There's so much to talk about. There's lots of news coming out of University Health. Mm-hmm. But I want to start with my own memory of what University Health was to the people of the West Side.
Okay.
Because for the people of the West Side, where it all started was Robert B. Greene. And people would just say, voy al Robert B. Greene.
Mm-hmm.
And people knew where they were going. And in my family, I don't ever remember having health insurance. Although I have to tell you a little thing that my dad always told my mom, yo no sé por qué le pusiste Elaine. Le hubieras puesto Dolores. He probably wished he had health insurance for me. But my mother went there and got a lot of her health care there, had her babies. She only had me in a hospital at Santa Rosa. All of the others were in clinics. Yeah. And she preferred them. Because her last baby, I was the third one. Her last baby was back in a clinic.
Wow.
So take us back to University Health.
Before it was University Health?
Before it was University Health, it was the Robert B. Greene.
The Robert B. Greene. And the Robert B. Greene was built about 1918 as a public hospital.
That was the flu.
And it was brought in, yes, it hit.
Oh my God. What flu was that?
The Spanish flu.
The Spanish flu. Oh God, it killed so many people.
It did, worldwide. And there was a very popular county judge, and I don't remember how he died, but he died and his name was Robert B. Greene. He was not a doctor, he was a county judge. And the community, he must have been beloved. And so they built that hospital in his honor. And that's where the Robert B. Greene gets its name, from the county judge. Aww. And so it's originally it was just that central building. If you look at the Robert B. Greene, it's still there, still up. It's got a central building. That's what was built in 2018. And then during the Depression, the 1930s, the East Wing was built. By the way, it has no foundation, and so it's beginning to separate.
Oh, you're kidding.
But it lasted almost 100 years.
Oh, my goodness.
So
it had no foundation. That seems like
no piers to the ground. And then on the west side, on the west side of the Robert B. Greene main building, they built another wing in the 1950s. And that is solid. It has piers. The 1918 has piers. But it's really 3 separate buildings that look like one building.
From that first effort during a very hectic, very stressful time, we now have this massive public hospital system. Mm-hmm. And I was just saying before we started I don't know how you sleep at night because, 2 hospitals, 30 clinics or almost 30 clinics. Tell us what it looks like.
I'll give you this picture because I talk about this all the time. As important as hospitals are, and they're very important, the more important thing to have when you're a public system is a lot of clinic locations because 95% of what we do is in the ambulatory. People get sick with the flu or a cold or, fall and break their arm, small things, not major things.
And your patient is a low-income person without.
Well, it was created to make sure that we took care of the uninsured. Mm-hmm. So when you look at the enabling law, of course, I'm a lawyer. It was created in the hospital district itself. Although the public system in San Antonio started in 1918, the hospital district was in fact created in 1955. There was a vote of the people in 1954 because what happened, the Robert B. Greene Hospital was being jointly funded by the city and the county, and that was creating a lot of friction between the two, particularly by the taxpayers, because if you lived in the city, you paid taxes to the county for the Robert B. Greene, and then you also pay taxes to the city for the Robert B. Greene. But if you lived out in the county, you only paid once, and if you lived in the city, you paid twice. And this happened not only in San Antonio but around the state. And so there was a constitutional amendment that was put on the ballot in 1954, and then that passed here in San Antonio, Bexar County. So then the Bexar County Hospital District was created, and then from then on, it was just one district countywide. So that's really the beginning of the hospital district itself.
But now it's University Hospital, the big level 1 trauma center, and we have a brand new
Women and Children's.
That's at
right there. It's attached to the University Hospital at the same location, and then we have about 28 locations, in addition to a couple of mobile vehicles. Like we have a mobile mammography bus that goes to places where there's a lot of women who are work in the workplace and they can't get away to get their screening mammogram. We take the bus to them. So we've kind of exploded when it talks to ambulatory care. When you go back and look at us in the early 90s, we only had the Robert B. Greene downtown and University Hospital. That is it. No clinics anywhere, no prevention efforts anywhere, no buses anywhere. It was just those two locations. And they were very important, but San Antonio was growing, Bexar County was growing, and people realized in the 1990s that it's not so much about hospital care as it is about health care, keeping people healthy, rather than just fixing people when they're sick or broken. You have to do both.
And the newest hospital's on the horizon, and
right.
I'm a big fan of the one on the south side.
And I appreciate that.
Tell us about those two. The one on the south side is going to be called Palo Alto.
University Health Palo Alto Hospital, and then the one on the northeast corner by Retama is going to be called University Health Retama Hospital.
Well, tell us what the Palo Alto Hospital will look like, how big, and what you imagine it becoming.
So both hospitals are designed identical. So
really?
So that staff can go between hospitals if they're necessary. They know where everything is. So we have one architectural team designing both. Now the outside may look a little different because the Palo Alto Hospital is across the road from Texas A&M. We want to give it a kind of an A&M flavor to match their buildings, and then the Retama Hospital look maybe slightly different, but internally it'll be the same. The hospitals are actually two buildings. They have a hospital, and then they have an attached medical office building. And that's important because there's no doctors in those areas. You need a place for doctors to have their offices. So it's very convenient to have the office building as part of the hospital building. And so so we're building both at the same time. A hospital, and right now we expect them to be about 166 beds, designed to 286. So designed to almost 300. So they're being designed for 300. But the opening will be 166 for both.
And so when will each open up?
It's going to take about 36 months to build them. Each site has their own challenges. And if we're talking about the Palo Alto Hospital, you and I have talked about this before, the infrastructure on the south side is lacking.
Oh, yeah. There was nothing out there, electrical, no water, and nothing was running. So you had to start from scratch.
You start from scratch and start with the infrastructure. So, for example, on the Palo Alto Hospital, we've already spent about $12 million regrading the site, putting in drainage that's required by the city of San Antonio to catch the water from those parcels of land that are across our Zamora that drain towards our land, and they're north of us on the same site as our Zamora, the Vida housing project that's there. So all that land drains south, and so our 68 acres is south of that. So we're having to put drainage, and we've already had, and it's almost complete, but we started that about 9 months ago in doing that. The other challenge is going to be, as you already pointed out, electrical, because we need 2 feeds for a hospital from 2 electrical substations. And, thank goodness CPS is on top of it, but, they have challenges like we do with supply chain and the like, but that's something that they're going to have to upgrade both of their substations and then run electrical lines to our hospital. So that's going to take some time. So all these things have to happen.
But once they do that, then
it helps develop that whole area.
That whole area, right.
So the good thing is exactly that they were kind of maybe the spearhead of some developments, just like Toyota was and just like Texas A&M was.
And then on the Retama, it's been easier to develop, my guess is, because so much of that is already developed. There's lines for electric and water.
That's exactly right.
I love that they're being designed the same way, so everything's in the same place for those, Hey, will you have a problem staffing it?
I think staffing is a challenge for all health systems, particularly with the retirement of baby boomers. And the baby boomers are a significant part of the population. And
like you, they're retiring.
They're retiring. People who were born after the World War II and, are reaching that age where they say, how much longer can I keep this up? And so a lot of nurses, and so there's going to be a big shortage of nurses and other professionals, doctors, and techs alike. And so that's one of the reasons that since the whole time I've been CEO, one of the biggest objectives that I had, personal objectives, is to help health career schools develop, particularly in the high school arena, to encourage kids going to health careers. They're great careers to be in. And also to help the colleges build nursing programs and other programs. In Palo Alto, there was just an article in the paper Monday that Palo Alto just got approval. The Palo Alto college that's down the street from this new hospital is going to have a nursing program. That's great.
Yeah.
And so you need to kind of leverage everybody's investment.
And that's the other part of the system is that they're teaching institutions, right?
Right.
Are all of them teaching institutions?
Well, A&M and Palo Alto and University of Incarnate Word, and to some degree UT Health, which we're partners with and have been partners since 1968, are all going to have some teaching. But I think the big thing is that they're going to grow and generate the next generation of healthcare workers of whatever kind. Nurses, techs, doctors, PAs, nurse practitioners. We're going to need them all. And to have relationships with these schools is very important to grow them. It's going to be important for us, but it's also going to be important for all the other health systems here in town as well.
The big news is that you announced that you are retiring this year, I'm assuming, although the search for a new person is going to be nationwide. Probably not a South Side boy.
Probably not, yes.
That's what we want.
Yeah. It's been a really, really wonderful opportunity for me. Having grown up here.
Gone to St. Mary's Law.
St. Mary's, gone to high school here.
Oh, no, you didn't go to St. Mary's Law, did you?
Undergrad. Undergrad. And but it's been a wonderful opportunity to have the ability to work in your hometown and to actually make a difference. It's been wonderful. I announced my retirement, and I mentioned it to the board at their December board meeting, so they would have time to do a recruitment. And I'm going to hang around as long as they need me. So there's no set date yet.
It might not even be this year, George.
It'll probably be this year.
Oh, it will be?
It'll probably be this year.
Okay.
But they're starting the process and of doing that recruitment. I am blessed to have a great team. And so, there's several people I hear from my team that may be applying.
That's good news.
That is good news. And because they
have the experience, they know.
And they know the community, and they've been working on some of the projects that you just talked about, like the Southside Hospital. And so they want to see those things completed too. So,
you won't get to see that completed in your tenure.
No, I won't see. I'll see it completed. Hopefully, I'll still be around. But I won't be CEO.
So what?
It's going to take three years.
Yes.
Yeah.
You've over 40 years with this system. At least 19 of them, probably closer to 20, right?
As CEO?
Uh-huh.
19 years, 1 month, and 9 days.
Okay. But whose county?
Whose county? Whose county?
So what do you look back at as your highest, would you consider great achievements, or maybe the lowest of lows?
You know, I have been blessed. And it's kind of funny. I'm going to digress a little bit because actually Don Finley sent me something this week and I was laughing.
Don Finley, former medical reporter for the San Antonio Express News.
So he interviewed me a long time ago, probably in the 90s. And what he found humorous and he wrote about was the fact that in the 1970s, when I was with the city attorney's office, I was working for Jane Macon. Jane hired me.
Oh my goodness.
So
you guys go way back.
So Jane hired me and I worked for her
So
for 5
city
years.
attorney's office, not county.
City attorney's office.
Mm-hmm.
And one of the things we did in the 1970s, when in 1978 there was a case called the Lupe Guerra case, and we actually sued the Bexar County Hospital District. And so I was one of those attorneys working with Jane and the legal aid and the Department of Justice and a couple of other.
What did the hospital do?
The city decided to sue the hospital district because it was closing the OB section of the Robert B. Greene, because the hospital moved over to Medical Drive in 1968, but in 1978 the babies were still being delivered, downtown at the Robert B. Greene, and there was a community uproar with that, and and because that was there. To your point earlier, we were talking about it. There
was great ownership.
Great ownership. Of that, and then so there was a lawsuit from the city of the county. Now the city ended up losing, so we lost the lawsuit. So they didn't hold it against me when I started working for them. But we lost the lawsuit. But I always said we won the war because we ended up doing many of the things that the city wanted to do. We rebuilt the Robert B. Greene. We've put in a first class operation there. It's very important to that community. Mm-hmm. It's better now than it's ever been.
It's a beautiful landmark too.
It's a beautiful landmark too. Yes, and then University Hospital, as the population has moved north, is in the right place. Mm-hmm.
It's somehow not as far to us psychologically. It's a more routine sort of trip when someone is there.
Well, when I was in high school in the 1970s, it was a long way to do 410, right?
Yes.
But But now it's like, no, 1604.
Yeah.
Yes. So, and if you look at the population, I had one of the VPs, Ted Day, asked him to show me the demographic distribution of the population in San Antonio and Bexar County. And the actual dividing line is 410 for most.
Yeah, that's
so south of 410 is half the population, and north of 410, look how far north that is. Yes. It used to be downtown.
And when San Antonio was founded, it was right there at the cathedral.
Right.
It's no longer the center.
No longer the center.
I have another anecdote that I just thought of. I had to tell you about Robert B. Greene. My mother, when she would go there, and sometimes I would go in summertime.
Right.
And she would get something to eat at the little kitchen, the little cafeteria.
In the Brady Building.
The Brady Building.
Yes.
And she loved, during Easter time, the ladies would make capirotada. It was the best capirotada. Those ladies were excellent. I still remember them with their little hairnets.
That Robert B. Greene kitchen, the little had a following.
Yes, downtown people would stop there.
Yes, and I remember when I first started going. My first board meeting was actually before I started working there, because after I left the city attorney's office, I went to work in the DA's office for 7 years, and I started that in January of '83. So my first board meeting, I was introduced to the board was December of '82. So I went to the board meeting there, and all the board meetings were held downtown at the Robert B. Greene. The committee meetings were held at the hospital, but the board meetings were held downtown because they just loved eat over there.
The ladies, they were excellent.
There was a woman named Virginia that was head of that, and she's like an awesome cook, and the board members, we want to eat downtown.
Yeah, absolutely. My mom always made we're gonna go to that coffee shop.
Yeah,
It was so nice to have you.
Absolutely.
I wish you much luck. Oh, what are you going to do in retirement?
No plans yet. I have plenty of gas in the tank, and I plan to do things. But I think at the outset, I'm just going to chill a little bit and maybe read. I'd like to write.
Well, great,
So
George.
I may end up writing.
About what?
About what happened along the way, from the time I grew up here in San Antonio to the time I became CEO.
Oh, that's a wonderful book project.
So that now that I've said it publicly, I probably have to carry it.
Oh, absolutely. I'm going to call you about it.
Yeah. So where are you on the project? Yeah.
Yeah, where are you? Are you writing?
Yeah.
Well, good luck.
Thank you.
So nice to have you here.
Absolutely.